Hi, I'm Dr. Sneha Lime. I'm a senior physician and researcher working over here for the last 10 years. Today we are going to discuss about a disease called asthma and the risk factors that are associated with causing asthma in adults and pediatric population. Asthma predominantly is a gene-environment interaction disease. And when I say gene-environment interaction, what I mean is there is a lot of genetic predisposition involved in the causation of asthma in an individual. The genes are passed on and the heredity plays a very important role in causing asthma in a particular patient. An environment in which the individual stays or grows up or works and lives acts as a very important trigger factor for triggering the onset of asthma at some point in time, mainly either in the childhood or in the early adulthood. So there have been close to 100 genes that have been identified for asthma, but the researchers have not been able to pinpoint on which specific gene really leads to passing on of asthma into the next subsequent generation. However, it is very important for a physician to know that the transmissibility is of atopy, the allergic tendency that gets transferred or transmitted from generations to next generations. And when we say atopy, we include asthma, we include allergic rhinitis, we include eczema and migraine. The importance of sharing this information is that you have to look for the presence of any of these four symptoms or diseases in patients when you have a provisional diagnosis of asthma in your mind. This is a very interesting slide which tells us about the proportion of each of these factors contributing to a risk of asthma. And as you can see, family history and cesarean delivery form a very important and very strong risk factor for development of asthma in individuals. Family history, we've already spoken about, the genetics come into factor. Cesarean delivery, so we're going to see a lot more into detail when I come to the subsequent slide. Exposure to air pollution. Now you may wonder how air pollution is related to asthma, but I'm sure each one of you have been seeing increasing number of patients coming to you with breathlessness, wheeze, and symptoms that are more suggestive of asthma in the growing era of rapid urbanization. And you may be wondering why do we see so much of increase into asthma these days? Now, little did you know that diesel exhaust particles, they increase the allergenicity, or the pollution, PM particles, they increase the allergenicity of the allergens by around 50 times, which means that an individual who is predisposed or who is in a polluted environment is at a much higher risk of developing asthma. Diwali is just going to be around the corner now. Did we know that the firecrackers that we burn emit humongous amount of PM particles, SO2, NO2 and all these noxious gases into the air around us? You all must be aware by now about the city of Delhi choking by now because of the crop burning, and so much so on going on into media and into discussions in Central Ministry about banning the crackers. Well, a lot of people, they have their emotions and think, kya hota hai? We just burn the crackers just for 1 day or 2 days during Diwali. How does it really affect the environment and affect our health? The slide shows you that the SO2 level, the sulfur dioxide level, it becomes more than 200 times higher during the period of Diwali compared to what it is before and after Diwali. And it is very important for all of us as the healthcare providers to understand why we see this spike in the number of cases that we see during and after Diwali. From your practice, you certainly must be noticing that there's a sudden spike in the number of URTIs, cough, eye irritation, skin irritation, and asthma and COPD exacerbations that we see in and around Diwali. And perhaps that is the main reason that the entire environment gets heavily polluted and overloaded with these noxious irritants that irritates the airway and leads to an exacerbation of asthma in those who are already patients and leads to trigger of asthma in patients who are at a borderline or at a predisposed risk for asthma. Now, so this is something really interesting. All these years from our medical training, we have been believing that asthma is caused by genetic transmission. Asthma is caused because of patients going into a lot of infections. What we did not know that there are many indoor air quality issues, indoor air pollution issues that lead to increased risk of asthma. Did we know that burning mosquito coil, which it's a very, very common practice in India, and we burn it to get rid of mosquitoes. Mosquito coil emits huge levels of PM particles and carbon monoxide, which again is a huge airway irritant and predisposes us to the risk of asthma. Burning one mosquito coil at night for 8 hours in a closed room is equivalent to smoking 100 cigarettes in a day. And therefore, it is very important to check out the burning of mosquitoes when you're taking down history of an asthmatic patient. Same with burning of incense stick. We use them to offer prayers. It's a very common practice to have these agarbattis, dhoop, being burned in every house during puja practices. These emit huge amount of soot, tar, huge amount of PM particles, which again is very injurious to the air tract. Smoking at home. I'm sure it is not enough for me to reiterate that smoking is a very, very harmful activity. Second-hand smoke is as harmful as direct smoking, and therefore smoking in the household premises should certainly be avoided. If you're treating a patient of asthma who has a smoker at the house, you have to counsel the patient to not have anybody smoke in the house. And then most important, exposure to biomass. This has been discussed and debated at the global forums for the last many years. Now that the women who cook, predominantly women who cook in the house every morning, every evening, using biomass as a fuel to cooking. This predisposes them to an increased risk of not only asthma but COPD, which we are going to see in the subsequent presentations. And therefore, this history again is very important in arriving at a provisional diagnosis. Presence of fungus in the house. If you have an asthmatic who has been exacerbating again and again, do not forget to check out on the history of presence of fungal spores or presence of water leakages in the house. Because unless this is addressed, the asthma is not going to be under control, because fungal infections are an important predisposing factor for the risk of asthma. Intrauterine and perinatal exposures. It is very fascinating to understand that if your mother has smoked when you were in the womb, the chances of child getting asthma is 160%. And if the grandmother had smoked when your mother was in her womb, then this is going to be further more risky of 180% chances of you catching asthma, you developing asthma. And this is very important and very interesting insight into epigenetics, which we are not going to discuss more. But the point is that you have to ask people to stop smoking when you have a pregnant lady around in the house. Similarly, when the child inhales all these kind of irritants, it is very notorious and very harmful for the airways of the child. Having newborn, something digging into the history where our elder ones used to say that you should use clothes, use beds for the children. The main reason behind it is all these new furnitures and new clothes, they emit volatile organic compounds, which again is a high irritant for the airways and puts the child at a risk of developing asthma later on. Something discussed globally very widely, paracetamol. Paracetamol has been found to be a strong risk factor for development of asthma in the later years. And therefore, not that you should not use paracetamol in children, but please use it very judiciously. Keep the use to as minimum as possible. And last but not the least, obesity. Increasing urbanization, poor lifestyle is leading to kids to be much more obese, and obesity in itself is an important predisposing factor for asthma. Several occupations that are related to asthma, and you must dig into the history of occupation during your history taking: painting industry, construction industry, welding industry, and farming industry. So risk factors for COPD. So by history, by the classes we have taken in our medical schools, we know that smoking is a very predominant cause for development of chronic bronchitis and asthma, and now clubbed into COPD. There are around 10 million smokers in India. And there are different forms of smoking, predominant in different parts of India in form of cigarette, hookah, chillum, bidi. But little did we know that COPD in India and in the developing world is not just caused by smoking, but there are many, many more factors into it. And that's why we are here today discussing about some other risk factors than smoking that lead to COPD. This slide is a very important one. This is the data from the Global Burden of Disease recently released. And this shows us a very important message. And I'll go to the next slide, which will put the numbers into better perspective for you. Compared to 37% of global population having COPD due to tobacco smoking, if you see the data in India, 27% and 24% COPD in India is caused because of non-smoking causes, because of air pollution, ambient and household. And just 14% of the COPD in India is caused because of tobacco smoking, which is very different from what we see in the Western world. By now you have already known that COPD is a disease that is caused by chronic toxic insult to the lung. So in some form, there has to be a repeated irritation to the airways, repeated insult to the parenchyma and to the airways. In 2009, we at Chest Research Foundation did some very remarkable landmark studies in the field of non-smoking COPD and showed to the world that there exists a plethora of different reasons why Indian patients develop COPD other than just smoking. And these causes ranges right from the polluted air to the things we burn in house to the things that are burnt and added onto our atmosphere, and we are going to see them one by one. Compared to 1.1 billion smokers, that is, cigarette smokers in world, we have around 3 billion people in the world who inhale biomass on a daily basis because they have been using this as a primary source of fuel in their houses. And this in turn hugely predisposes them to the risk of developing COPD in the later life. And what is most important is the mother, predominantly who is a cook in the house, is always accompanied by a child who is playing around. And it's not just the mother, but the entire family, and most importantly, the child, which is inhaling this soot, this PM level, this PM particles and all these pollutants day in and day out for years together. And therefore, it predisposes these children to be developing COPD at a later time in life. It's very important to dig out into the history of exposure in any patient of you are suspecting to be COPD, that what was the cooking fuel used, what are the sort of exposures they had when they were children. Mosquito coil, again, we use this very commonly, very regularly to get rid of mosquitoes and keep us safe from dengue. But what we don't realize that along with the smoke, there's a lot of toxic inhalant particles that go inside our lungs. Burning one mosquito coil at night with closed doors and windows is predisposing us to smoking 100 cigarettes over that period of 8 hours. So one mosquito coil is equivalent to 100 cigarettes smoked. Now you can imagine the amount of toxic pollutants that go into your lungs. So the message is not that don't use this. If you have a better alternative options, go for it. But if you have to use this for whatever reason, the mosquito coil, keep your doors and windows open and safeguard yourself from inhaling these toxic fumes. Now, temple pujaris and this incense sticks and dhoops that we offer for praying, these are emitting huge amount of toxic pollutants. And a study that we did in the temple priests showed us that 25% of the priests showed evidence of airways obstruction, and the data was completely adjusted for smoking. So non-smokers, priests developing this possibly due to the day in day out exposure they are having to dhoops and other things burned in the environment of the temples. High ambient air pollution. Urbanization is leading to more and more addition of more and more pollutants in the atmosphere. Needless to say, all of us are bearing the brunt of it. We can see how we are choking, how the cities are choking, kids are choking, and it's time there to do something about it. Traffic pollution. I think it's no news in India now that we are unfortunately started in the cities measuring distance in terms of time and not in kilometers, because of the huge number of vehicles that are on the roads, huge number of traffic jams that we face in the daily travel. And every time there are vehicles waiting, they release an increased amount of PM particles and gases into the atmosphere. And that itself is making the air more and more polluted around us. Construction industry, growing rapid urbanization, big schemes and lovely apartments coming up. But that comes at a cost of adding so much of dust, so much of particles and fumes into the atmosphere that it is becoming an increasing threat, increasing risk to the lung health. Outdoor air pollution. Needless to say, we have been seeing how Delhi is choking at this point in time due to the crop burning and due to the Diwali festival coming up. The scenario is similar in the entire nation. And outdoor air pollution becomes a very, very major risk factor for development of COPD in the later life. There are several occupations that are associated because of the fine particles that are emitted or because of the continuous inhalation of these toxic fumes which are emitted as a part of these industries, mainly farming, leather industry, animal husbandry, sweeping the floors outside in the road, basically leading to a lot of dust production, mining industries and pesticide industries. All people working in all these industries are at a huge risk of developing COPD and should be regularly screened for development of airway limitation with the help of spirometry. And whenever you get a patient we are suspecting to be a COPD, must dig out into the occupational exposure of these patients. So all in all, what was earlier known, COPD, what was earlier known to be a disease due to tobacco smoking, now has become a much wider zone incorporating a lot of other reasons than smoking, mainly occupations, exposure to biomass, air pollution, and some genetic factors as well. What is more noteworthy is that apart from just noxious stimuli, which I have been talking about for the last 6 or 8 minutes, there are some other factors too that have been recently identified in the research world that are contributing to development of COPD, and this is some real new data. And these factors are low birth weight, childhood respiratory infections, poor diet, poor nourishment, asthma which has not been treated properly, and past history of TB. So these are all very important predisposing factors for development of COPD. Do look out for a history of low birth weight, TB in your patients whom you are suspecting to be COPD, because post-TB COPD is a very new area of research. We have been doing a lot of work on this, and I'm sure in a few days we are going to come back with some more robust data on the development of post-COPD post-TB COPD in patients. So in my last slide, I would like to summarize the classification of COPD on the basis of risk factors. So COPD can be caused because of non-tobacco smoking causes and tobacco smoking causes. Amongst tobacco smoking, you would have cigarette smoke, bidi smoke, hookah smoke, and other forms of smoking. And very interesting, in the non-tobacco smoking phenotype, you will have exposures to noxious stimuli, and you will have COPDs that develop because of no exposures per se. You will not find real exposures, noxious exposures, but they still develop COPD. So the ones that develop because of noxious stimuli exposure are household air pollution, indoor air pollution, ambient air pollution, and occupational exposures. And the ones that develop COPD because of non-smoking causes, and you have not been able to identify some repeated insult to the lung, are poor lung growth, recurrent respiratory tract infection, poorly treated asthma in the past, and post-tuberculosis lung diseases. So do look out for all these factors in the history taking of a patient whom you are planning to diagnose as COPD or whom you suspect is a COPD patient. Do not miss out on all these risk factors. Thank you very much.